Hello and happy Thursday. Welcome to another edition of 2 Minute Emergency. I am Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And each week I bring you another episode of 2 Minute Emergency, which are ideas, inspirations, and information to keep you healthy, safe, and out of the emergency department. So today is finally a beautiful day as far as weather here in Texas. A little bit overcast, but we're finally starting to warm up, and I am so excited that spring is finally here. So speaking of the changes, what I want to talk about today is stress and how stress can affect us. So one question that I get fairly often is, can stress cause a heart attack? Not exactly. So the short answer is no. However, there is sometimes episodes that people have where they have chest pain, otherwise known as angina, that is related to stress. There is a particular disease called Takotsubo's cardiomyopathy. And what that is a time where it's caused by increased stress. So heart attacks are caused by blockages, times where arteries get clogged and the blood flow doesn't get through the heart and a part of the heart dies. That's basically a heart attack. But in Takotsubo's cardiomyopathy, instead of having a blockage, it causes the heart just not to pump efficiently. And it is thought, although not 100% clear, that this is related to a hormonal surge. So think about it as fight or flight. And so when those hormones surge, the heart isn't pumping effectively. And so all sorts of other cascading events happen. So it can lead to increased blood pressure and acts just like heart failure. So you get the swelling in your legs, the shortness of breath, and yes, the chest pain. It's also known as broken heart syndrome. And as I said, it's stress that causes this. So they gave it that name because it often happens when a loved one passes. And so the heartbreak of losing that loved one can lead to this. So it's more common in women aged anywhere from 58 to about 75. That's something important to remember. However, that's one aspect of what stress can do to us. Hi, Karen. Thank you so much for joining me here today. I'm glad to be. So when things like this happen, it's treated like regular heart failure. And you may get diuretics to help get off some of that fluid. But the good thing about it is it's self-limiting. It usually lasts anywhere from 2 to 4 weeks, and the body just heals itself. But what are the other things that stress can cause? Stress can cause so many other changes, because think about it, one of the things that happen when you're stressed, I know one of the things I do is I don't eat right. Sometimes you crave those sweet things, those salty things, and food, face it, it's called comfort food for a reason. It makes us feel more comfortable, more relaxed, and we tend to go off the rails as far as taking it too far. You feel better the more food you eat. You become more sluggish, you lay around, you don't exercise, and it's almost like a self-perpetuating cycle as far as what stress can do to us. So one of the things I wanted to mention that we as women, what do? We take pride in accomplishing as many things as we can in as short a period as we can. Because think about it, it's a badge of courage to be called a superwoman. I can do it all. The question is, at what cost? You're stressing yourself, and I'm just talking about the physical cost here. I'm not even talking about the emotional or psychological side of things. It wears on us. It definitely does. And so when you're under stress, you've got to think a couple things. How can I handle this? What can I do differently? So some of the things we can do differently. Start off with meditation, or some people call it mindfulness. just taking that time apart from whatever the stressor is. Just take yourself apart from it. It may mean that you need to wake up a little bit earlier in the morning. It may mean you need to stay up a little bit later at night. It may mean you just need to retreat to your bathroom. I don't care what it is, but time away from whatever is causing you stress to just breathe. Exercising. Exercising can also play such an important role. Getting outside. As I mentioned, the weather is getting nice. Get outside of the home. Breathe that fresh air. Take a walk. No one says you've got to go run a marathon, but just get out and get active. You'll find that the hormones that are generated, our own endorphins, I should say, they're generated with exercise, make you feel better. That alone is worth it. Absolutely. Other things I mentioned, getting away from the situation. So, for example, you're at work and whatever project you're involved with, coworker, something is stressing you out. It happens all the time. We know that. What can you do? Sometimes it means physically separating yourself from that coworker, or sometimes it means just setting boundaries so that that coworker knows what to expect from you, and vice versa. Or even if it is your boss, what are your limitations? How much are you able to handle? There are times when you just need to say, I can't do anymore. No, I'm not going to add that additional task. It may not even be part of your job, but your boss knows you can handle it. You don't have to handle it. There are times when if you know you've reached your limitations, you have to let people know. If you don't let anyone know, people are going to assume you've got it covered. And that goes not only at work, that also goes at home, whether you're by yourself or with family. Your family expects you to be that superwoman because that's what you've already put out. Take a step back. Everything does not always have to be perfect. I'll just say for myself, let's see, my ability to hold on to papers, yeah, you could call it clutter. Definitely call it clutter. I have a habit of holding on to everything, and I will procrastinate as far as clutter until it gets to the point where it drives me nuts. I have to clean out and start over. That causes me stress. I change something. I do something to make those changes. Other things that can happen is, as mentioned, exercise, but you also want to try hobbies. Hobbies are wonderful. You find something that you love to do it. And it can be anything. Knitting, it can be artwork, it can be reading, it can be cooking, it can be so many things. You need an outlet. Everyone needs an outlet. Hi, Susan. Thank you so much for joining me. Thank you. So these are some of the things you can do as far as making those changes in life every day. And I mentioned women in particular, as I have said before, this is Women's History Month, and I'm kind of taking it that extra step, even though I'm not talking about history today. Just a couple of facts. So depression and mental stress affects women more than men. Diabetes. Women with diabetes are at a greater risk of heart disease than men with diabetes. Smoking. Smoking is a greater risk for heart disease in women than in men. Alcohol consumption. So we've all heard a little bit of red wine, great for you. I'm not arguing that at all. But watch your amount of consumption, right? Because alcohol causes other problems with the heart, which I'm not even going to go into today. Keep in mind, too, that as we go into menopause, we lose that protective effect of estrogen, which is cardioprotective. So we come up to men's level as far as cardiac, that alone. And also during pregnancy, for those younger women, if you are diagnosed with hypertension or diabetes during pregnancy, you're more likely to have that continue even after you deliver and on a long-term basis. So these are all things we've got to keep in mind. Also, autoimmune diseases such as lupus, rheumatoid arthritis, these are more common in women. So there's so many things we as women, we're different than men, we know that. And these differences we've got to think about, because women don't always, when we're talking about heart disease, women don't always have those same symptoms when they're having heart trouble or a heart attack. It's not that, I've got this crushing, terrible chest pain. Not necessarily so. Sometimes it's, especially as we get older, it's just fatigue. It's shortness of breath. Simple thing, minor pain. It may be back pain, because some of that can go to the back. Now, I'm not talking about low back pain. I'm talking about upper back pain, things like that. So I want you to keep in mind of different ways. Think about how you can lower your stress levels to live a more energetic and healthy life. You will feel so much better. Your heart will thank you, and you will actually live longer when we take care of ourselves. So self-care really is key. And on that note, I think I may have to take a long bath tonight just to relax. So I thank you so much for joining me. Joy, thanks for joining me. And thank you for the compliment on my hair. And I wish you all the best in this upcoming weekend. Take time to do something for yourself. And I want you to keep these topics in mind as you stay healthy, safe, and out of the emergency department. Until next time, I'm Dr. Leslie. Take care and stay healthy. Bye-bye for now. Thank you, Susan. Enjoy yourself.